Right now, many countries are watching the flu very closely. China is facing a significant wave of H3N2 influenza. Public health officials there have described this flu season as particularly severe. In fact, some reports call it the worst in 4 years. Test results show a very high number of people are getting sick with the flu. At the same time, here in the United States, flu activity is also on the rise. We are seeing more people visiting doctors and hospitals for flu-like symptoms. Sadly, the US has already reported several flu-related deaths in children this season. This is a clear signal that we all need to be paying attention. The main virus causing concern is a type of influenza A called H3N2, but you may also be hearing about another virus called human metapneumovirus, or HMPV. It is also circulating and causing respiratory illness. It is important to understand what these viruses are. Knowing the facts helps us separate concern from panic. The situation in China, with its high positivity rates, serves as a warning for the rest of the world. Viruses do not respect borders. What happens in one part of the globe can quickly affect another. Our health systems are monitoring this activity carefully. This is not a time for fear. It is a time for preparation and knowledge. The information from public health agencies like the U.S. Centers for Disease Control and Prevention and the World Health Organization is our best guide. They are tracking the viruses. They are updating vaccine information. They are providing guidance. In the U.S., the CDC notes that influenza activity is elevated and continues to increase across the country. We are seeing this trend in multiple key indicators, from doctor visits to lab tests. Thankfully, so far, the overall severity indicators remain low. The goal is to stay ahead of the curve. By understanding the current landscape, we can take practical, proven steps to protect ourselves and our families. The rise in cases in China, driven by a specific subtype of H3N2, and the increasing activity in the US, create a clear picture. The flu is here, and it is active. We need to be vigilant, especially in protecting the most vulnerable members of our communities. Let's look at what we are dealing with and what we can do about it right now. So what exactly is H3N2? It is a subtype of the influenza A virus. Influenza A viruses are known for causing more significant illness. They are often the culprits behind seasonal flu epidemics. They can change or mutate quite rapidly. This is why we need a new flu shot every year. The current wave in China is being driven by a specific version of H3N2. Some have called it the K-type strain. It is not a brand new virus. It's a subclade, a branch of the H3N2 family, circulating widely right now. This K strain has also been detected elsewhere in the Northern Hemisphere. United Kingdom, Canada, Japan. This fuels concerns among scientists about rapid evolution and whether it could cause more severe disease. When a virus spreads this widely, it shows efficient transmission between people. Public health experts are watching closely. China reported a 47.8% positivity rate in late 2025. How does a virus like this travel? An infected person coughs, sneezes, or even talks, releasing tiny droplets with virus into the air. Someone nearby can breathe in those droplets. The virus can also land on surfaces like doorknobs, phones, countertops. If you touch that surface and then touch your eyes, you can become infected. That's why a surge in one region can appear in another. International travel can move the virus across continents in hours or days. Good news, this season's flu vaccine appears to offer protection. Even though the K strain emerged too late to be included in the 2025-2026 vaccine, the current shot still produces antibodies that can fight it. One expert called that unexpected good news. Getting vaccinated is still a very powerful tool. It may not be a perfect match, but it gives your immune system a critical head start against this dominant H3N2. That's the best defense we have. While H3N2 is getting a lot of attention, another virus is also making people sick. It is called human metapneumovirus, or HMPV. First, it is crucial to understand that HMPV is not new. The World Health Organization has clarified this point. Scientists first identified it back in 2001, but it has been circulating among humans for many decades, unlike a new virus like SARS-CoV-2. Most people have some level of pre-existing immunity to HMPV. This helps explain why we are not seeing an overwhelming crisis. HMPV typically causes symptoms similar to the common cold or a mild flu cough, runny nose, sore throat, fever. For most healthy adults and older children, HMPV is usually mild and self-limiting. It is one of the many viruses that contribute to what we call the common cold. Chinese health authorities have confirmed current respiratory infection levels are within the expected range for a normal winter season. Their hospital systems are not overwhelmed, which is a reassuring sign. However, HMPV can be serious for certain people. It is a common cause of upper and lower respiratory infections, especially in infants, young children under the age of 5. Their immune systems are still developing and their airways are smaller, making them more susceptible to severe symptoms. Older adults are also at a higher risk. Their immune systems may be weaker and they are more likely to have underlying health conditions. People with compromised immune systems or chronic conditions like asthma or COPD are also more vulnerable to severe illness from HMPV. One of the challenges with HMPV is that there is currently no vaccine to prevent it. There are also no specific antiviral medications approved to treat it. This is different from influenza, for which we have both vaccines and antiviral drugs. Therefore, managing HMPV relies on supportive care. This means resting, staying hydrated, and using over-the-counter medications to relieve symptoms like fever and pain. For those at high risk, prevention through good hygiene is the most important strategy to avoid getting sick in the first place. When we talk about flu season, it is vital to know who is most at risk for developing serious complications. While anyone can get sick from the flu, the illness is not equal opportunity. For some, it is a week of misery. For others, it can be life-threatening. The first group we must always protect is older adults, generally those aged 65 and over. As we age, our immune systems naturally become less effective. This is called immunosenescence. It makes seniors more likely to get sick and to suffer severe outcomes like pneumonia. The second critical group is young children, especially infants under 2 years old. Babies have immature immune systems. Their small airways mean inflammation can cause serious breathing problems. The CDC tracks pediatric deaths from influenza, and the 8 deaths reported so far this season are a tragic reminder. Influenza B viruses, though less common this season, are known to cause particularly severe illness in children. Beyond age, many underlying health conditions dramatically increase risk. This includes people with chronic lung diseases, asthma, COPD, heart disease, kidney disorders, liver disorders. Individuals with weakened immune systems are also high risk. HIV/AIDS, cancer treatments like chemotherapy, long-term steroid use. For these individuals, their body's primary defense is compromised, giving the flu virus a dangerous advantage. Pregnant women also fall into a high-risk group. Changes in immune system, heart, and lungs during pregnancy increase risk. Finally, these risks can compound. An older adult who also has heart disease faces substantially higher risk than a healthy person of the same age. Understanding these risk factors is not about creating anxiety, it is about empowering action. If you or a loved one falls into one of these categories, be proactive. Taking protective steps like vaccination and seeking early medical care for symptoms. Section 5. 7 steps for robust protection. With flu activity increasing, we can, take clear, proven steps to protect ourselves and our communities. First and foremost is vaccination. The CDC recommends a seasonal flu shot for everyone 6 months and older. As we have seen, this year's vaccine shows promise against the circulating H3N2K strain. For seniors, there are special, more potent options. Second, practice excellent hand hygiene. This is simple but incredibly effective. Wash your hands frequently with soap and water for at least 20 seconds. If soap and water are not available, use an alcohol-based hand sanitizer with at least 60% alcohol. Make it a habit to wash your hands after coughing. Third, consider wearing a mask. A well-fitting mask, worn in crowded indoor settings, can provide a strong barrier against respiratory droplets. Fourth, know when to test and seek medication. If you develop flu-like symptoms, especially if you are in a high-risk group, contact your doctor. Rapid tests can confirm if you have influenza. If you do, antiviral medications like Tamiflu can be prescribed. These drugs work best when started within the first 48 hours of illness. Fifth, practice respiratory etiquette. Cover your coughs and sneezes with a tissue or your elbow. Sixth, clean and disinfect high-touch surfaces. Regularly wipe down doorknobs. Regularly wipe down light switches. Regularly wipe down remote controls. Seventh, stay home when you are sick. This is one of the most important community-minded actions you can take. By isolating yourself, you prevent the virus from spreading to your colleagues and others in your community. This protects everyone, but especially those who are most vulnerable to severe illness. These 7 steps form a powerful Section 6. Building a stronger immune defense. Building a stronger immune defense. While vaccination is our frontline defense, hygiene is our frontline defense. Supporting your body's natural immune system is also a wise strategy. Think of it as training your internal army to be ready for battle. A strong immune system may not stop infection, but it can reduce severity and duration. One of the most important pillars is adequate sleep. Adults should aim for 7 to 9 hours of quality sleep per night. During sleep, your body produces and releases cytokines, proteins that target infection and inflammation. Nutrition plays a vital role. Fruits, vegetables, whole grains, lean proteins. Regular, moderate exercise boosts immunity. Aim for about 30 minutes most days. Manage stress. Finally, preparation. Now is the time to act. Schedule your flu shot. Talk to family, especially elderly relatives. Talk to parents of young children. Stock your home. Thermometer. Stock your home. Tissues. Stock your home. Hand sanitizer. Stock your home. Fever-reducing medications. It's normal to feel concerned about flu surges. Turn concern into calm, practical action. Get vaccinated. Practice good hygiene. Support your overall health. Keep yourself and loved ones safe this season.